Well, how do I manage kidney stones at home without having to go to hospital? Well, you want to take advice not just from a doctor such as myself, but from someone who's had it not just once, but twice. Yes, I've had kidney stones twice. And ladies, the debate is officially over. Kidney stones is worse than childbirth. I promise you, it is worse than childbirth. Basically, as you know with kidney stones, the pain can be so intense that you think that your back or even your abdomen is about to burst. And it's so intense that you're thinking, should I call the ambulance? Should I go to hospital straight away? But there are certain things to consider. So for example, you could be waiting 6 hours just in the emergency department. And by the time you see a doctor, in majority of the cases, you've already passed the kidney stones. Also, it can be a situation where you've got children. Do I take all my children with me to hospital and be waiting there for 6 hours? Imagine you've got a 6-month-old baby. And as a woman, if you're a woman, you have to carry the baby and you've got kidney stones, especially when there's no one else to help you with the baby. So these are all the dilemmas faced when you have kidney stones. So let's talk about how to manage kidney stones at home. First of all, how do I know I've got a kidney stone? Well, a kidney stone, as you know, tends to be either on the right or on the left side. Very rarely do you have pain in the middle. It's usually on the right or the left lower side of the back. In some cases, it can radiate down towards your abdomen, towards your groin, and sometimes towards your urethra. And that tells you that the stone is trying to pass its way through. But when the pain is focused on the lower back, or should I say the lower flank, and is concentrated there, it means the stone is obstructed and the muscles, the smooth muscles of your ureter are trying to squeeze to get the stone to pass through, but the stone is stuck. And that's why you start getting those spasms, those severe pains where you just cannot find any comfortable position. And that's how you know you've got kidney stone. Also, there are special tests you can do, such as a urine test. If you do a urine dipstick and you dip the stick in your urine, you find that you've got quite a lot of blood in the urine. And that's a signal that, okay, the stone is damaging the lining of the ureter, which is causing blood in the urine. So the first thing you want to do at home is that you want to pace yourself. You would notice that you cannot sit still because the pain is so bad that you have to walk up and down. So I advise you, try and pace yourself. Do not walk too fast because you're going to end up getting out of breath. Try and pace yourself in terms of walking at a slow, steady pace. Walk up and down, maybe sit for a little bit, get up again and sit, because that way that helps to distract yourself, from the pain. Or maybe you can watch TV, listen to music as you're doing it, even talk to people. When I had my kidney stone, I was talking to my kids because I was like, what do you want to eat? What's going on TV? Just do things that helps to distract you from the pain, because kidney stone, as I say, is worse than childbirth, though my ladies will differ. Another thing to consider, which is quite important, is painkillers. Most people will find that painkillers do not actually help when it comes to kidney stones. However, it is better to take something than nothing. So you can take a combination of paracetamol and ibuprofen together to maximize the pain relief that you get with kidney stones. If you have stronger painkillers in your cupboard, like prescribed cocodamol or naproxen from maybe what you've used previously for another problem, then you can also take that because that's stronger than paracetamol and ibuprofen. But what's very important is you need to drink lots and lots of water. Because why do you have kidney stones in the first place? It is probably because you've not been drinking plenty of water. Imagine you work in the office, 10, 12 hours a day, you feel like you cannot get up to, to have a break, to drink water, or you're someone who does a lot of exercise and you're not drinking enough water to replenish what you've lost. So basically, dehydration is one of the most common causes why stone forms in the kidney. So you want to drink lots and lots of water, drink at least 2 liters of water, just flush them down, just flush gallons of water through, because your kidneys, you have to remember that your kidneys are like filters. They help to filter all the toxins, they help to filter the waste, they help to filter all the excess water. And by drinking the water, the stone is now in a medium. It's thought that the pressure from the water would help the stone to finally start to pass through. And then when you start having pain in the abdomen, groin, and the urethra, then you start realizing that, oh, actually, I'm starting to pass the kidney stones, because you start having these funny symptoms. If you're a man, you've got penis, you start having this funny, what we call strangly sensation that, having this mild tingling or discomfort in the urethra of my penis. So that means that you're starting to pass the stone. One thing that a lot of people don't realize, which I accidentally found out that can help my kidney stones, was a hot water bottle. So you've taken painkillers, you've been pacing yourself up and down, you've drank lots of water. As you know, it can take a few hours for you to pass a stone, and you feel like, oh, this pain is so unbearable, I'm about to call the ambulance. Get a hot water bottle. When I had the hot water bottle, I slept, because the hot water bottle actually helps to relax the muscles of your back, because your muscles are going to spasms, the kidneys are going to spasms as well. So what the hot water bottle does, you just put it on the affected side where the pain is. So if it's on the right side, put it on the right side. The hot water bottle helps to relax the muscles and makes you a bit more comfortable, at least for a bit, before the spasms might probably start again. So that's one thing that I found that was actually immediate relief more than the painkillers and the pacing around and drinking lots of water. Is later on you start to get the effects from drinking plenty of water. If you've tried all this and none of this has helped, then obviously you've got no other option but to go to hospital. So you go to hospital, you have your 6-hour wait as you would expect. You see the doctor does the x-rays and tells you, oh, there's no kidney stone there, which means that from the drinking lots of water, you have probably passed the kidney stones while you're waiting on the emergency department or while you're in the house. And that's what tends to happen in the majority of the cases. And you think, oh, did I have a kidney stone in the first place? Yes, you did, because it was a pain worse than childbirth. You possibly did a urine test which showed blood in your urine. And what is the difference between a kidney stone and a back pain? So sometimes it can be quite difficult to differentiate between both. What you would realize is that with back pain tends to be more localized. So back pain might be in the middle of your spine, or just adjacent or parallel to your spine. And with back pain, it helps with posture. So you might find that if you stretch yourself in a certain way, or if you sit in a certain way, the back pain helps. Whereas with kidney stone, no change in posture makes you comfortable. In fact, you might find that some postures are worse than others, with kidney stone. Also, with back pain, it tends to help with taking painkillers like your paracetamol and ibuprofen in some cases. But in kidney stones, we find that paracetamol and ibuprofen just does not touch it. Also, back pain, as I said, tends to be localized. Very rarely does it radiate to the legs, for instance, of the sciatica. But with kidney stones, you might find that it moves around. Like you might have pain in the middle of the back, all of a sudden it's on the right flank. Then you've got pain in the right lower abdomen, and you're thinking, have I got appendicitis if it's on the right side? Because you can have pain on the left side as well. But if you've got pain on the right side, you're thinking, have I got appendicitis? Usually you'd be calling the ambulance if you think you've got appendicitis, or going straight to the emergency department if someone can take you there. And then you might notice that the pain is radiating, towards the bladder area. So that's one sign that will tell you, okay, this is more likely to be kidney stone than a back pain. Also, if you've got the privilege of having a urine dipstick in the house, you will notice that with back pain, you do not get blood in your urine. But with kidney stones, you notice that you've got blood in your urine. That's because of the damage the stone has done to the lining of the kidneys. So I hope this information helps you in terms of how to manage a kidney stone at home without going to hospital, and also how to tell the difference between a kidney stone and a back pain. Take care.